Good afternoon, everyone, and welcome to today's session. Sorry, this quiz is supposed to start at 10 a.m., but I could not be able to make it up. But better late than never is the rule of the game called entrance preparation. So very good to see 20 online. Ayat, Vani, Harsha, Navina, and many more. Please invite your friends also. Even if you are a little late, you can always join by entering kahoot.it on your browser, and then it will ask for a pin, and a pin is visible while the quiz is going on. You can enter the pin. So, shuru karenge kya? Are you ready with the guns? Are you ready with the daggers? Are you ready with the arrows? Are you ready with the grenades? Let us bomb the Paediatrics quiz and let us see who is going to be the topper. The one who is topper gets rupees 40,000 worth of online mbbs.com video library, 65 full-scale grand tests, and 3,000 video lectures, 30,000 MCQs, Q scanner, topic-wise classified, 1 lakh PowerPoint slides of notes, and daily live online interactive class. All this, which is worth of 40,000 rupees, you will get it for free as a prize when you win the quiz tournament. So every day we conduct 3 quiz tournaments: morning 10 a.m., afternoon 2 p.m., night 10 p.m. And every week, we have 6 days in the week. 6 into 3, 18. The whole set of subjects are done every week. So every week, these 18 quizzes will give you 1 round of wheeling around all the 19 subjects. And we conduct all 52 weeks. Totally about 1,100 quiz contests we will be conducting, and to about 1,100 people who are topping each quiz contest, we give almost 40 crore rupees worth of online mbbs.com subscription as a prize. So that is the reason. Tell your friends and join the game. So, yeah, Navina, we will continue our evening live online interactive class. There had been a short interruption past in this week. So from Monday onwards, we will restart the evening sessions. No worries. So, doctor, let's make the beginning. Very good. Can you see the screen? 125 1845 is our pin. Very good. Jyoti, Abhi, Bahu, Nin, Akhilesh, and many more. Very good. So I'm still waiting. We have 30 online on the YouTube. Another 6 more players to join the race. Today, let us see who is going to win 30,000 rupees, 40,000 rupees. Prabalika, Bhaskar, Milky, whoa, Guna Sundari. Excellent. Just go to kahoot.it and keep punching this pin number. Even if you are a little late to the session, doesn't matter. Even if you join little late, the pin will be visible in the bottom. You can always enter. Excellent, doctor. We also have staff warriors also joining the game. Dr. Rajita, Praneeth. Wow, excellent. It looks like today we are going to touch almost 50 players. The more the merry. You can tell all your friends. Morning 10 a.m., afternoon 2 p.m. and night 10 p.m. Every day 3 quizzes, 3 subjects. And every week we finish all the 19 subjects. Excellent. So doctor, shall we make a great beginning? 36 players in the game and many more joining. Jaku, yes. It is all about a game of speed. How fast you are able to punch is most important. Great. 3, 2, 1. Are you ready for the game? Which is commonly seen in the infants of the diabetic mothers. Which of this is commonly seen in infants of diabetic mothers? Boom, boom, boom. Excellent. 6 of you are absolutely right. Polycythemia. Polycythemia is typically seen in the infants of diabetic mothers. Now, doctor, that brings Bhaskar to the top of the game, followed by Jyoti, Karthik, SR, and Avijit. What is wrong about the workup for hyperbilirubinemia? You need to work up for hyperbilirubinemia. When any of these criteria are met, oh, I think there is a little lag over between the video and the quiz. If you can give me 2 minutes time, I will try to reset the timing to 30 seconds instead of 20 seconds. What do you say? I think that will help a lot. 1 minute, doctor. I'm just cancelling this quiz. So time became up before the question is displayed. That's right. So I will do end the game. 1 minute. So just give me Just give me 1 minute time, doc. I'll try to change the timing of the transition and then we will replay because it is going really too fast. Yeah, you need to enter the pin once more. Sorry for the interruption. We changed the timing to 30 seconds. This looks much better. Just you need to re-log in with the new pin 4805672. Very good to see Dr. Prakash, Kuldeep, Vinay, and many more. Please invite some of your other friends also. I'm waiting for 5 more to join the game. Very good, Tarun Kumar, Dr. Bahu. Very good. Good to see 41 players. Almost 42 players. Very good. Even if you're a little late, please punch. Let us make the great beginning, doctor. 3, 2, 1. Which is commonly seen in infants of diabetic mothers. We have already dabbled on this. I think all of you will answer this correctly. Very good. 21 of you answered correctly, saying it as polycythemia. That keeps Ravi Kumar on the top, followed by Karthik, Jyoti, Anwar, and Abhi. Now, what is wrong about the workup of pathological hyperbilirubinemia? You need not work up pathological hyperbilirubinemia. All the others are the criteria to work up for pathological hyperbilirubinemia, except very good. 37 of you have rightly answered. When the direct bilirubin is more than 2 milligram per deciliter at any time, not 4. That is the point in this question. That brings Thor to the top, followed by Ravi, Abhi, Alladi Vinay, and Pri. Very good, doctor. So you should know all the criteria. The direct bilirubin more than 2 milligram per deciliter any point of time. That is the criteria, not 4. What is wrong about breastfeeding jaundice? This is very important. Breastfeeding jaundice is different from breast milk jaundice. Punch. Breastfeeding jaundice versus. There are two closely linked differential diagnoses. Right. 5 of you are correct. Infants become jaundice even at the time of the birth. When it is breastfeeding jaundice is what you need to remember. That brings Jyoti to the top, followed by Anwar, Shweta, and Thor. So you should know few important basics. Breastfeeding jaundice versus breast milk jaundice. Breastfeeding jaundice means the baby is not nursing well. So the baby is not getting many calories. It's very common in the first time breastfeeding mothers. The infant becomes dehydrated. There is lack of calories that is leading to jaundice. And basically you need to arrange for a lactation consultation in order to teach the mother how to properly feed the baby with the mouth of the baby and the nipple of the mother with a proper orientation. And this kind of jaundice is seen in the first days of life. Whereas breast milk jaundice जो होता है, it is because of the glucuronidase which is present in some breast milk. The infants become jaundiced in the first 2 weeks. Only after the 2 weeks, week 2 of life, they become jaundiced, is what you need to remember. Now, doctor, the next question. Jaundice, hepatosplenomegaly, thrombocytopenia, anemia, microcephaly, chorioretinitis, and this CT scan. Chorioretinitis, microcephaly, thrombocytopenia, hepatosplenomegaly, and this. CT scan. Where do you see? Very good. 4 of you are right. It is toxoplasmosis. I know CMV is the closest differential diagnosis, but chorioretinitis is an important clue. Otherwise, periventricular calcifications is also the feature in the case of the CMV, is what you need to remember. Very good. It is a tough round. 3 players have lost in a streak. Jyoti is on the top, followed by Anwar, Shweta. Yes. Now, we need to remember toxoplasmosis is jaundice, hepatosplenomegaly, thrombocytopenia, anemia, and microcephaly. Rubella, cataracts, deafness, heart defect. CMV, microcephaly, periventricular calcifications, thrombocytopenia, keratoconjunctivitis, and meningoencephalitis. But not the chorioretinitis. That makes it toxoplasma, retina involvement. So, doc, this is a feature of, where do you see this as a feature? Where do you see this as a feature? So, Josna and Tarun are saying that the question is moving too fast. So, I will try to make the next quiz with 60 seconds. I don't know. The live streaming today on the YouTube is going a little too slow. There is more than 10 seconds of lag over. So that is the reason, though I gave you 30 seconds, it is still appearing to be too small. So, yes. All right. Afternoon 2 o'clock when we play the quiz, we have today we have afternoon 2 p.m. quiz. I will try to increase the timing. I'm sorry about this huge lag over in the live streaming. Okay. So, but anyway, since we are almost half the way the quiz, please continue punching the answers. Yes. So, doctor, the next question. So what you have seen is the clenched fist, which is classical of trisomy 18, Edwards syndrome. So growth deficiency, mental retardation, short sternum, along with this rocker bottom feet, hammer toe, omphalocele, clenched fist, they're all the classical features, is what you need to remember. 60 seconds is too long, actually. People will start checking into the Google and start answering. That's the reason we don't want that. Okay? Now, what happens in constitutional delay? Constitutional delay. Punch, punch, punch. Constitutional delay. Very good. 7 of you are absolutely right. Born age less than chronological age is what you see in case of constitutional delay. That brings Sweta onto the top. So you should remember, when the born age is less than chronological age, constitutional delay or any chronic systemic disease or endocrine related, it will be born age less than chronological age. Born age more than chronological age is if there is any obesity or familial tall stature. Similarly, precocious puberty, congenital hyperplasia, hyperthyroidism, they all born age more than chronological age. But born age is equal to chronological age. Where do you see? Typically, it is in the genetic familial short stature. And whenever any chromosomal abnormality is causing short stature, born age is equal to chronological age. So that is the reason with every quiz, please carry a 200 pages notebook. It's not about winning. It is about participating, fighting the quiz, getting ourselves charged so that the whole day, morning 10 a.m., 2 p.m., evening 10 p.m., when there are 3 quizzes with 3 subjects every day, you are all charged to fight. And those questions which you are really going wrong, please go back to the onlinemmbbs.com video library and kindly do the revision, right? So now, doctor, a 8-year-old boy has been under the 2nd percentile for the height all his life. Hand X-ray for the bone age assessment shows 8-year-old only in the bone age. So what is the most likely diagnosis? Punch your answers, doctor. So it is a familial short stature. Bone age is equal to the chronological age is what you need to remember. I'm really sorry about this slow live streaming by the YouTube. It didn't happen earlier. Today, unfortunately, it is happening. So afternoon 2 p.m. quiz that we are going to have in the subject of dermatology, I will try to increase the duration of the entire question. Okay, so please bear with me. So Dr. Thor is on the top, followed by Jyoti and Shweta. Contraindications to breastfeeding. What are the contraindications to breastfeeding? I mean, except. I forgot to mention except. In this question, except is a contraindications to breastfeeding except. Sorry about that. What is except contraindication to breastfeeding? Absolutely. Mastitis is not a contraindication to the breastfeeding. That keeps the Thor on the top. Thor on the top. Yes. So you should know all the list of contraindications to the breastfeeding emphatically. Human milk is richer than the cow's milk for all these except. Punch your answers, doctor. Human milk में ये सब चीजें ज्यादा रहता है. Human milk is richer than the cow's milk for all these except. Dr. Reddy, I am really sorry. I will try to definitely make the live broadcast on the YouTube little better. This never happened in our earlier quizzes. Today only YouTube is very slow to stream the my screen. So really sorry about that. So yes, doctor. So Thor is still on the top. Prati is the highest climber. So you should know all the differences between human milk and cow milk. Human milk is for the human babies. Cow milk for the calf, not for the human babies. Always mother's love, mother's milk is sweeter. Lactose is more in the mother's milk. Mother's milk is low in vitamin K, whereas cow milk is low in vitamin C, and vitamin D is what you need to emphatically remember. A young boy is able to walk, build a tower with 7 blocks. He plays well alongside other children, and he can say, my toy, my turn. He has an inventory of 50 words. What is the most likely age of the child? What is the most likely age of the child? Very good. His 2-year-old child who is able to build about 7 blocks is what you need to remember. So, doctor, Thor is on the top, followed by Bhaskar. Now, a mother brings her 4-year-old son for evaluation of nocturnal enuresis. The boy never had a significant dry period. He has regular bowel movements without constipation or encopresis. What is the next step you want to do? Punch your answer, doctor, very fast. Six of you are correct. Reassure the mother that this is normal for the boy's age. So Dr. Thor is still on the top, followed by Ravi Kumar, Bhaskar, Jakku. Now, what is a wrong statement among the following? What is a wrong statement among the following? With regarding sleepwalking and the nightmares, you should know the difference between the two. That's right, 5 of you are correct. I'm really sorry, by the time the questions are coming up, the time is getting exhausted. Yes. Sleepwalking occurs in the first third of the night, not the last third. Whereas the nightmares and night terrors are in contrast. So you should remember the differences between the two. First third of the night is sleepwalking. Last third of the night are the nightmares. Slow wave sleep is the sleepwalking. REM sleep is the nightmares. No daytime sleepiness or recall, typically in the case of sleepwalking. So that's the point you need to appreciate. Now, doctor, what is a wrong statement about varicella? Varicella and the vaccination. Punch your answer, doctor. What is a wrong statement about varicella? Do you want to give vaccine to the healthy infants? Do you want to give? Very good. Varicella zoster immunoglobulin is not contraindicated in pregnant women. You can very much give the varicella zoster immunoglobulin is what you need to basically remember. So, doctor, everything, anything about varicella, immunoglobulin, and the vaccine, you have to be 100% sure. A 5-year-old boy has a low-grade fever, runny nose, non-productive cough, mild stridor for 2 days. He is non-toxic, but he makes a sound like a seal when he is coughing. So what is the next step? So what is the next step? Very good. You can discharge him with a close follow-up, asking the mother to bring if the symptoms worsen, and you need to have a good follow-up. That's the only thing that you need to do in this given scenario. No role for steroids, no role for any heroic actions, because a simple viral crew is known to resolve. A 15-month-old girl presents to the outpatient clinic on a winter afternoon with fever, shortness of breath, wheezing, hyperinflated lungs, peribronchial coughing without consolidation. Very important clue on the chest X-ray. What is your likely diagnosis? Punch, punch, punch. In this 15-month-old girl, very good. 5 of you are correct by saying viral pneumonia. Absolutely right. So peribronchial coughing is a very important feature for you to know. So doctor, let me once more tell you, hyperinflation with bilateral interstitial infiltrates and peribronchial coughing, viral. A confluent lobar consolidation, pneumococcal. Bilateral lower lobe interstitial pneumonia, clinically it looks worse. I mean, radiologically it looks worse than the clinical presentation. Clinically it looks ordinary, but radiologically extraordinary. That is mycoplasma. That's what you need to remember. The last question for the today's quiz. Sorry about the YouTube, which was not in my control. But afternoon 2 o'clock quiz, I promise you to give you a decent time for you to punch the answers. I'm so thankful to all the 45 of you for coming and joining the quiz. And don't forget to log in once more at 2 o'clock for the dermatology quiz. Very good. 5 of you are right. In this 12-year-old girl diagnosed with asthma, she has night symptoms twice a week and daily daytime symptoms. So based on the clinical picture, you should know what level of severity is this bronchial asthma, and accordingly you need to decide what is the treatment protocol. So, doctor, the last question. What is wrong about selective IgA deficiency? Selective IgA deficiency. What is wrong about it? Do you want to call it as the most common immunodeficiency? Do you think giardiasis is common in IgA deficiency? Can you give IV immunoglobulin? Is the incidence of malignancy increased? Punch your answer. Absolutely. IVIG is contraindicated if there is IgA deficiency. But IgA deficiency is the most common immunodeficiency. Giardiasis is common and incidence of malignancy is increased. So because of the difficulty in broadcast, all of you could not participate effectively into the quiz. So we declare this, uh, there is no prize given for the topper because all of you could not be able to punch. It's like a democratic election. So afternoon 2 o'clock for the dermatology quiz, no worries. We will repair everything. Please come along with all your friends. We are going to give you some challenging image-based questions in the dermatology quiz, afternoon 2 o'clock. Until then, ta-ta and goodbye. But still, we need to clap those who could be able to answer and reach the top. So the time for us to honor the people who have got onto the top. So Prati is on the position 3. Ravi Kumar is on the position 2. And Bhaskar is on the position 1. But Bhaskar, you need to win the dermatology quiz in order to get the 40,000 rupees cash prize. So thank you very much for joining. Once more, see you all at 2 p.m. Ta-ta, goodbye.